Morning, ladies and gentlemen. How's everyone doing? Wait. Cool. We're fortunate today. We now have 3 speakers. We've grown organically from the last session, and we've snuck Joanna in on the end. And I won't pronounce your last name because I don't have the gesticulation yet.
Antongiovanni.
Thank you. So we're going to
It
go in
looks
reverse order
intimidating.
here,
It's really not
apparently.
that bad.
Anyway, the speakers we have are going to address the products, changes in the marketplace as a result of the Affordable Care Act, in addition to the various ways that business now needs to prepare an account for their employees as it pertains to health care coverage. The Affordable Care Act has drastically changed the product offerings available to business. And I'd like to take a moment to introduce 2 of our speakers because the third one was here earlier, so I'm going to do ad hoc here. We have here this morning with us Andrew Grove, Vice President of Sales for the Employee Benefits Consulting Division of SWBC. It's big enough. Can you hear me? I used to have it loud enough. And Will Haff, Managing Director for J. Wortham LLC. Andrew recently joined SWBC, where he is involved in leading several aspects of the division, including the management of the sales team and its resources. In addition, he will plan, develop, and execute objectives, policies, and programs for marketing and sales activities. Before joining SBC, Andrew was the SWBC, beg your pardon. That's a very important lesson for us, isn't it? My apologies. Andrew was the large group practice leader for Humana's South Texas market. He attended the University of Texas at San Antonio, is a licensed health insurance counselor and licensed general lines agent, life, accident, health, and HMO. Will, as a managing director at Wortham, brings 16 years of experience specializing in employee benefits programs for medium to large size groups in the public and private sector. He has specialized in large accounts in a consultative capacity for the past 6 years, and his main areas of expertise include risk mitigation strategies for large, fully insured, self-funded medical, dental, and disability programs. Will has also been active in the design of several national carrier programs, along with industry-specific plan design in the educational marketplace. So as you see, we've got an enormous amount of expertise here, so please feel free to ask questions. This is intended to be interactive, and I'll turn it over to you, John.
Okay, great.
Stand up.
Yeah. Well, thank you very much for that introduction. It makes us appear very intelligent. I guess we'll find out at the end of this if we really are. And we brought Joanna in case we're not, so we should be okay. Thank you for the introduction. I am Will Haff. I'm Managing Director with Wortham Insurance and Risk Management and Benefits. And with me is Andrew Grove, a longtime friend of mine, who is the Vice President for SWBC Employee Benefits Consulting. So thank you again for taking this time. I'm brain dead after listening to Joanna and Josh. That's just a wealth of knowledge and information. And you had Ernst & Young before us. Wow. So we're going to try to keep this as simple as possible. We want to keep this interactive if we can. The last group we had asked a lot of questions, but I heard you ask a lot of questions, so I guess we'll find out. So my wife and I were talking early this morning about healthcare reform because we knew this was coming up today. And I know Andrew's my age. Joanna's not my age. She's young, but she's smart, but she's younger than me. But anybody in here remember the Lucille Ball show? Raise your hand. Okay, you guys remember the episode when Lucy and Ethel, they go to work at the candy shop? And so the candy's coming across, and they're doing good, and they're wrapping it, and then it starts coming faster, and so they're eating them, and they're stuffing them down their shirt, and finally it's going so fast, and it's hilarious. Well, that's how we all feel about healthcare reform. They kind of started us out nice and slow, and we were able to unwrap it a little bit and get it out to our client, but now it is just coming at us so fast and furious that it's hard for us to keep up with. And we deal in it every day. I can't imagine for an employer out there how you do it and you run your business or your area of expertise. So we're with you, and we have a wealth of experience up here, but none of us have experience in this. Just like Joanna showed, it's a road not traveled yet. So we're all going to be going down it together, and we're going to be going fast and furious, but hopefully if you partner with the right expert, we can help you navigate that course.
And I would add to Will's comments, my experience is relatively new on the consulting side of the business, but being with a major carrier for 20 years, you would think like, God, these guys, they know it all, but it is uncharted territory for us. I think, our traditional 2 or 3 times a year, maybe talking to your insurance broker, and then, or even sometimes 1 time a year when the renewal comes up and going through your options, making your decision, move on. Those days are gone. Those days are gone. And I would applaud you for being here today to come in and listen and hear Josh speak, hear the folks from Ernst & Young speak, hear Joanna speak, because we all have to get informed because things are coming and things are going to happen. I know that we do, Will and I, and in my experience and out there in the community, a lot of employers are aware of it. We get asked about healthcare reform a lot, but there's still a pretty large percentage of employers out there that do still have their head in the sand somewhat. I talked to an employer this weekend. He said, gosh, I don't think this thing's really going to work, and they're never even going to be able to collect the fees. And I said, well, the IRS is the entity that's going to collect the fees. So I think they're going to do a pretty good job of collecting the fees.
They do a great job collecting my fees right now.
Exactly. So one way or another, they're going to get their fees. And then secondly, I've talked to other friends and close associates talking about their business and their own, small businesses, and asked the question, well, if you've done your notices yet for your employees for the exchanges that are due October 1st, they said, I don't even know what you're talking about. I don't know what you're talking about. My agent didn't even come to see me last renewal. So those days are gone. We all have to be on top of it. A lot of it is the employer's responsibility. You need to have the right partner, consultant, to help guide you through it. But a lot of it is on us all individually. I mean, the first and foremost thing, and a lot of this Joanna talked about and Josh has talked about, but it's just, it bears repeating somewhat. Now, it worked really well for us to do a quick overview in the beginning, and then we got down to really what our area is got down to what are you going to see when the agent comes out to see you at renewal? What kind of options are out there? What's going to change my health plan, that sort of thing, and we'll open it up for questions. But as I said before, the individual mandate's coming. Joanna talked about it, everybody talked about it. That's not going away, it's happening. January 1, 2014, we're all going to have insurance. Now, a lot of folks think like, well, God, this thing's not going to work and costs are going to go crazy and nobody's going to buy insurance because it's only $95 penalty. Well, it's $95 for an individual or 1% of their annual income, and then up to, for a family, it's $285. But as you see, it's a progressive penalty. So the whole thought process, I think, when our leaders created a lot of healthcare reform, the thought process was, well, even though we're going to allow people in and we're going to provide coverage for pre-existing conditions and we're going to have all these people coming into the system, ultimately costs will go down. Well, I think what you're going to find out now is initially costs are not going to go down. For more than of us than not, it's going to go up quite a bit. But then as time goes by and we have more people into the system, as the penalties increase and people feel that pinch in their wallet that they're going to have to get in, we're hoping that costs will stabilize. And we'll talk about some of the things also that your broker, consultant, your insurance carrier will bring out as options for you that are different things that we're trying to formulate and come up with, different strategies on how we can help mitigate the somewhat shock of some of the new costs that are being built into the system, and then hopefully level things out for the future. But as far as the mandate, it's coming. It's just right around the corner. There's no getting away from it. Now, the market landscape, obviously, there's all these different avenues that you can find to access coverage. If you're a small employer, your employees can get it through the exchange. You can get it through the exchange, off exchange. There's going to be private exchanges, which we'll address as we go along. Large group health plans, most large employers that I know, most of our clients are going to maintain their large plans. Some may not, but for the most part they are. And then obviously there's a plethora of government programs that folks will be accessing that'll still be available, that'll still be out there. So a lot of it relies upon education. You're going to hear this from Will and I throughout. It's education, and it's getting way out in front. It's getting way out in front of these things because they're going to be here before you know it. Employer shared responsibility, the big key thing, and I'm not going to go through every line here, you've seen a lot of these slides, is just determining where you fit. And there's calculators online that you can access. I Googled it this morning in the parking lot just to double check. There's lots of different calculators out there. So you really need to determine where you fit. Am I a small employer? Am I a large employer? Where do I fit in that? And depending on where you fit in that, things affect you differently. Will talk about a little bit later on, if you're a small employer, how community rating comes into play, how some of the different things come into play on that. So of the benefit changes, and then also we'll talk about some of the things around what they're calling pay or play for large employers. It's been postponed to 2015, but still, it's right around the corner. You know, we renew every year, things are going to come quick. So much more there. So that this gets into the counts. I talked about that a little bit more. I would, you can, access information yourself to calculate whether you fit in the 2 to 50 or the 50 plus range. We'll answer questions around that. And then also, we can, your broker consultant can work with you to show you where you're fit. If you've been in the Ernst & Young presentation, they probably talk to you about seasonal employees and part-time employees, how that all works. But we're going to get more towards down to products as we go along.
I'm sorry, real quick, an
Will,
example
please,
on that. Joanna actually had a great example yesterday for me of that. She has what is now considered a 12-employee covered life employer that is now, based on the new rules, considered a large group. So you may think that, well, I'm nowhere near this doesn't apply to me. In fact, based on one of those calculations, you may be in a different category than you think you are. Now, in that case, it could be a good situation that they're considered a large group, but nonetheless, if they're not educated on that, they may not realize that they're considered a large group by the carriers in Texas. So it's something that you need to make sure that you know.
Absolutely. And now, as a large, I'm sorry.
Go ahead.
Question back here.
12 employees, they just all working 120 hours a week. Sure, how did that?
So those 12 employees were the full-time employees, and so those are the ones that are covered on the health insurance. However, it's a landscaping business, and they have 109 total employees. All of the other ones are seasonal and part-time. Obviously, during the summer months, they're really, really staffed greatly. But the average total, so when you look at the first calculation, which is whether they're an applicable large employer, when they average out throughout the year, they're not an applicable large employer subject to penalties. But because their total number of employees, just total number of employees, because we're not dividing by 120 to do a calculation there, we're just looking how many employees, it put them over 50 each month. And so because of that, their AT&E, or their average total number of employees, is over 50, which puts them in a large group segment for their quoting purposes. So the products that they get from the carriers will be a little bit different. It's not going to be the community rating rules, and there's not going to be the $2,000 deductible maximum. So they're just the count actually is extremely important for various different things. So you have to, all employers, the key to the count piece of this is that all employers need to have a 12-month running total and know exactly what happens. So if you're not currently counting, starting January 1st, 2014, you better know your count each month.
So even if it's like your friend's kid who's going to learn how to mow lawns from 8 to 4 twice a week.
They count?
If they were a W-2 employee, which you gave them income, then they count. Right.
Aren't you glad we made her stay?
Yes.
Sorry, I'll try and be real quick.
No, I brought you in. My bad.
That's why we brought in our basically, and obviously, once you determine if you are an applicable large employer, you come 2015, could be looking at penalties. If you're not offering a plan that provides you the minimum essential benefits, or is deemed unaffordable, which is something that we've talked about already today. Those are the two things to keep in mind. Delayed to 2015, but obviously can affect you if you do one of those two things or not provide one of those two things. Minimum value of the plan. Plans must have a minimum value of 60% for 4 core services: physician services, hospital emergency room services, pharmacy, and lab and imaging. We hear that actuarial value word thrown out a lot. People go, what does that mean? Basically, actuarial value, if you had a plan that paid 100% of everything, that would have an actuarial value of 100%. So anytime we're talking about other plans, a 60% value means it pays 60% basically of the cost of your health insurance policy and so on. So I wanted to lay that out there to give you an example of that. Affordability, we talked about that already. So we're zipping through some of these things, but I guess the one key thing is I'm a big example guy, so I appreciate these 2 examples down here. An easy example of somebody that's making $24,000 a year, $2,000 a month, divide that by 9.5. The employee's portion can't exceed more than $190. That was one thing that I had to clarify in my own mind. Most employers obviously are contributing maybe 50% or 75% of the employee-only cost, so it just has to be, it has the employee portion.
Right,
premium,
and to
not
clarify,
the employee-only cost.
Right, to
Go ahead.
clarify, it's the employee's portion, and it's of whatever your low option is. So for those of you that offer multiple options, like a base and a buy-up plan, it doesn't apply to your buy-up plan. Where they do the calculation is based on that base plan on the employee-only rate.
And where does the unemployed spouse and children fit in that calculation?
It's a household income calculation, so they
But
don't.
for the employer,
Yeah.
employer penalty, it's really just the employee-only share. So
Correct.
that doesn't
Right.
apply, so the
Correct.
employer would not be
Your
exposed for
premiums to
a
the
penalty.
dependents and spouse are not factored.
They're not applicable in this case, that's right.
The only thing I would add to that deal is that as an employer, you can choose any of the 3 safe harbors to use.
Right.
So if you know, based on what someone's W-2 is, box 1 of the W-2 is what you're using, if you know what that is, then you can do your calculation. What if you're just hiring somebody on new and they've never gotten one before, right? We don't know what their income was. You could use the rate of pay. Let's say you pay them $7.25 an hour. The legislation gives us it tells us we have to divide that rate of pay by 130 hours of service. So that tells us, and you can't, it's not 120, it's 130. You got to use 130, but it tells us what their monthly income would be, and then you'd use the 9.5%, and then so it couldn't exceed $89 in this example. The third one that you can use is the federal poverty level. That's the same for everybody, right? So if you say, I'm not going to charge my employees more than $90 a month for insurance, we know just based on the federal poverty level, which in 2013 was $11,490. Okay, so that's what we're basing it off of. So if you say, well, my employees are charged $85 a month, I can tell you right now that you've met the affordability test because it's not more than $90 a month if that's the one you chose. Does that make sense? So you can use any of the 3.
Whoops, I'm sorry.
If you give us a card, we can send you the presentation.
We'll have,
Yeah.
I think these are, a lot of these are slides from
post
earlier,
these.
so
Yeah.
they're going to
Yeah,
give them
we're-
out to all the attendees.
Excellent. And then moving right along, really where we want to get to and spend the majority of the rest of our time is really where the products are going. You know, Will, if you want to jump in and take that. I
Sure.
just stood up so I could see this side of the room, and my boss is over there. So
Yeah, you got to.
My boss is right there.
Well, I want to impress Linda too, so I'm going to stand up too. So, again, this is an example of what the plans are going to look like, and it's based on that actuarial value. So, Joanna covered this earlier, but just so you know, what's going to be offered in Texas in 2014 is going to be the bronze equivalent exchange plan. So, that's what you can expect of. That's what the calculator looks like. We won't spend too much time on the health reform subsidy calculator, but that's out there. But really what we wanted to do is we wanted to get to the products. Okay, just past it. How many of you have done the exchange notice? Have you all done it? Everybody done it? If you haven't and you don't want to tell everybody in the room, just come see us quietly and we'll help you. But you need to get that out by October 1st. And I know Joanna stressed that before. It's very important. I think that's funny, Joanna. Please go there and see if I owe money to the government.
It's as funny as
Thanks.
insurance humor gets.
Yeah.
I know.
Over here.
I got a question.
Go ahead, please.
Who's required to give the notice, even if you're an employer 50 or less, are you still required to give the notice?
If you have 2, you're required to
You're
give them.
subject to the Fair Labor Standard Act,
Okay,
then you are.
we manage the Mandatory Homeowners Association, and they have seasonal employees of lifeguards, 4 months a year. Are they required to notify the lifeguards about that, even though they don't offer insurance?
Well, it's anyone who's on staff. So if they're currently not on staff because they're gone at school or whatever,
Yeah.
then they're not currently there. So when they come back to work for you, get back on payroll,
Right,
then
and
within 14 days back, they
So
have to have
next
it.
year we have to tell them.
So when you hire them and they sign their paperwork,
Right.
hand them the form.
Okay.
That would be free advice. Okay, it does, we went through this before, everybody's, as a U.S. citizen, covered by the Affordable Care Act. The small group coverage changes, and then we'll get into the products. How many of you are 2 to 50 employees right now? Okay, so this does apply to a number of you. How many of you went through the early renewal process where you moved your effective date to a 12/1? Any of you? Okay. Well, the reason Wortham had 178 of our small groups go through the early renewal process, and the reason they did is because of this modified adjusted community rating. And so how it works is in Texas before, you could have a 21-year-old male down here and a 63-year-old male up here, and you could have a variance of 7-to-1, which meant you couldn't charge 7 times more for this person up here as you could for this person down here. Well, now, what you've got is they've shrunk that. It's now 3-to-1. So it's gone like this. So if you're over 55, generally speaking, you're happy because your rate is probably going to come down. Now, for the vast majority of our groups, the vast majority of the employees are under 55. So what does that mean? Those rates are going up. So the reason they did the early renewal was to try to put off that modified rate for as long as they could. Now, what they're going to have to do is 12/1 of 14, because they're going to have to go through that process. And something else that the carriers could do is, before we could take a street rate that you got, and they could adjust that rate up to 67% based on the health conditions out there. Well, now they're rating everything up here, and we're working our way down. So it's more of a top-down system as opposed to a bottom-up system. So there are a number of reasons for the higher rates. For the small group market, that's the reason that the rates are going up the way they're going. Okay, let's talk a little bit about products. One of the reasons that we're going to see small group self-funded or other type of funding options for those small groups is because of just what I was talking about before. And how many people are familiar with a self-funded or a self-insured option? Thank you, Don. I know you are. Yeah. The rest of you? Okay. So as you know, with fully insured, what happens there is in exchange for a premium, you transfer all the risk to the insurance company. With a partially self-funded option, the employer actually retains some or all of that risk. 99.9% of our groups buy some sort of stop-loss protection to mitigate some of that risk. So you don't see a whole lot of groups with no coverage out there. Usually they have some sort of stop-loss protection. A lot of you may be partially self-funded. You don't even realize it if you have a HRA. Anybody out there have an HRA plan? Or you may contribute to some sort of HSA, which means you're transferring some of that risk. But really, within a number of our groups have an HRA where they have a higher deductible, but they'll pay a portion that they self-fund. So that's actually an example of that. Well, anyway, so with small groups, what the products are that are coming out is we all see these huge rate increases coming, and the carriers see them coming too. So what you're going to see are options where there's an alternative method of funding called self-funded out there for these small employers. And the reason they may be a good option for some of these small employers is, number one, it avoids the HIT tax, which is the health insurance tax that is put on to the fully insured marketplace. Well, guess what? When that tax is given to your insurance company, are they just going to eat that, or do you think they're going to pass that along? Yeah, so it's getting passed on in your premium. So again, that's a way that you could avoid that tax. The other thing it gets around, if you go back to that modified community rating we talked about, you're not subject to that if you're in a partially self-funded program because it applies to fully insured. So that's the reason we think that over the next couple of years, you're going to see a number of the small group market segment move into more of a self-funded type arrangement. And there are going to be a number of different products out there. So at the end of the day, what you're going to have is you need to partner with somebody who's an expert out there that can walk you through all those options. And one of those will be that option. Okay, large group level funding plans, much like the self-funded options, what you're going to see is some different hybrid type of plans out there that are going to be made available that are just going to give you more options. So you may take more risk being partially self-funded, but you're going to have some options that will give you a level funding option maybe for a couple of years, provided you hit certain criteria with the insurance carrier. So there's some options with that out there as well. Pooled products and captives. Let me check how we're doing on time. This could be an all-day conversation if you wanted, but really, with all the necessary changes that need to happen, one of the problems we've had in Texas is we've had a limited number of insurance options. You know, a number of you probably raise your hand, you've been with all the major carriers with your company, and maybe you're on your second go around with one. Well, we're really down to 4 or maybe 5 fully insured options out there. So there need to be other options available. And what healthcare reform has done is it's created new opportunities or new options out there. And so all a captive or a pool is it's just like an insurance company. And so all insurance is they take a pool of money, and based on those premiums that come in, they pay claims as they come in, and they look at their overall pool of business to decide what kind of premiums they need in order to run a profitable pool. Well, a captive is just like a private insurance company. So what happens is an employer agrees to join a captive, they take a portion of those premiums and they put it into that captive to pay some of the costs and the administrative costs that come out of the claim. So really, it works just like an insurance company works. It just gets you out of that fully insured arena. Does that make sense to anybody, or any questions on that? Okay. Many medical options. With changes in the law, you're going to get inundated with information that say, have I got the solution for you? And what I'll tell you about mini med plans is I'll tell you to be careful on what it can do for you and what it can't do for you. What it can do for you is it can help you avoid, we'll call it penalty A, which is you don't offer anything, so you don't pass the minimum essential coverage, so you get tagged for $2,000 per employee, minus the 30. So that is a way around that. What it doesn't do is it doesn't meet the minimum value standard that the bronze plan, for instance, would have. So once that employee doesn't take that coverage and they go into that exchange and they qualify for that subsidy, you're going to get hit for that $3,000. So if somebody comes to you and they say, well, this is going to solve your problems, maybe they don't understand what your problem is. So just be careful that when you look at these options that you're seeing all the information you need. Guaranteed issue individual plans. The good news on this is now spouses or children that don't take or can't afford a group plan, for instance, or may not have availability of a group plan, they can now go to the individual marketplace and get a policy on a guaranteed issue basis. Well, what's the bad news with that? The bad news for that is you got to pay for it somehow. So those rates are going to go up because the insurance companies have to adjust based on taking on no pre-existing, they have to take all pre-existing conditions, and they can't deny coverage. So the people who qualify, who have an individual plan now, are going to bear the burden of that. So those rates that maybe were lower on an individual basis, now most likely what we're going to see is they're going to be about where the group rates are because they follow a lot of the same rules. Medical plans tied to wellness initiatives or pricing based on participation in programs. How many of you have a wellness program for your company? Good for you. We have one too. Andrew talked about that SWBC does that as well. And so it's a great thing to do for your employees. It's something that, again, we're trying to do what's best for our employees. I think it's a fantastic benefit. And before you know it, it's going to be one of those essential benefits that your competition will offer if you don't. You may not realize it, but most of you probably have access to a wellness plan through your insurance carrier. But it's just a matter of education. You don't know what you don't know. And so there's a number of tools that all the insurance companies have in their own plans. And then you have a number of very good outside vendors that do a remarkable job with wellness.
Absolutely. I mean, as Will said, as a large employer ourselves, we incentivize our employees by giving them a little bit greater contribution for their health insurance to participate in a wellness program. And we really, and I think Will and I both agree on this, and Joanna, that we advise our clients heavily to implement wellness programs, because you're seeing so many things. We've talked about how a lot of these increased coverages, pre-existing limitations are going away. Some of these things, we're all thinking, how much is cost going to go up, and how can we do some things to help mitigate that cost? And I think we're at a point now where the insurance carriers are out there battling with the hospitals and the physicians trying to get the reimbursements down, that kind of thing. But I think we've probably got as far as we can with that. So really wellness programs, I'll get you just a second. Wellness programs, having folks do health risk assessments, biomedical testing, that sort of thing is really the next thing, and getting employees more engaged so they can access other programs that, as Will said, you're probably paying for already. If you're in an insured environment and you're with one of the major carriers, mostly all of them have incentive-based, rewards-based wellness programs that are accessible online, and it's just a matter of education. And in addition to that, if you do some of these things around testing and get folks to get their preventive care through education, they can maybe discover maybe they'll discover a condition that they have, and they can access maybe a chronic care management program through the company that you're insured with. So you can do that on a standalone basis and pay extra for that. But generally, the major carriers offer those things, some better than others, but it's something that we heavily advise our clients on. Yes, ma'am, you have a question?
Some of the products that would apply to wellness. I'm not a smoker, but if I'm trying to stop and my cardiologist says you need to stop smoking, is there going to be a discount or a list of products that will be applied to say, if it's coming from a physician, it's going to be a prescription?
Great question. So what you are going to see, and what we already do with a number of our groups, in particular in the large arena, the self-funder arena, you're seeing a lot of this already. We have a large client, and actually I think our employer and his employer does the same thing. Well, they charge a $30 premium to the employees for the base option plan. But if they do their health risk assessment and they enter into the wellness program and they follow the steps, they'll waive that $30 premium. So it could be $360 for the year. So as you can imagine, participation in that wellness program is fantastic. Where we don't see such great participation is where it's just purely voluntary. We would all hope, hey, come on, I'm bad about it too, but I'm in the business. So if there's not an incentive for people to do it, then by and large, we're seeing that the participation rates are just much lower than if you're willing to put some skin in the game to do it. So if you believe in it so much that you're willing to say, hey, I got to charge you a higher premium as an employee to cost share in this deal. However, I will give some of that back if you're willing to participate in these programs. And I'll caution you, do it that way. Don't say, if you don't do this, I'm going to hit you with $35 more. People don't take that real well. But if you say, this is what it is, but you can get it at this cost if you're willing to participate in the program. We've seen success with that.
And that's the beginning of it, is the premium differential, which is somewhat of a carrot. You can sell it as a stick, but then it's fine. Then if you have the incentives and the programs that someone can do to quit smoking cessation programs, and I would just check your plan document with the insurance company that you're with. Some have better coverage for some of these things than others, but many of them do, because wellness is kind of the trends now.
Go ahead.
So,
If the wellness benefit then makes the premium affordable at 9.5%, is that permitted?
Oh, that is a fantastic question.
Yes, and a wellness program can count towards your minimum value of your plan
It
as
can.
well. So you can count those things. Now, the small group market is going to be different than the large group market when we talk about wellness and smoking. The small group market, that's the only thing an employer's got. I'm sure he wants his employees to be healthy, but now he has an incentive for his employees to become healthy, because that's the only thing that they can do to get their pricing down.
Right, so.
And then
so
they
be
can charge
clear,
more for those
If our premium today is $150 a month or so, and we discount that $50 for participation in the wellness program, and that $100 turns out to be affordable for all our employees to have their box one income.
Go ahead.
You're on the right track. However, it's a calculator.
Right.
So there's an actuarial value calculator, minimum value calculator. So that would be put into either or calculator, and you can get credit for it. But you don't get full credit. So it's not dollar for dollar credit for a wellness program, nor is it, and then the smoking part that you had talked about earlier, the smoking is the only thing an employer can charge more for. You can charge 50% more. It's a surcharge. You can charge 50% more if someone is a smoker. Now, in the small group market, it would be the carriers that enforce that, which I haven't talked to any carriers that are willing to enforce that. So you probably won't see the smoker, non-smoker rates in the small group market. That'll mainly be just the large group market.
Another thing to look at in large group, and I'd say go talk to your agent. There's a certain amount that's legal that you can have a variance between somebody complying with the wellness plan or not. So you can't, let's say you want to charge them $200, but you'll charge them $30 if they do the wellness plan. That's not going to pass the calculation, but there's a certain calculation you can do based on that rate that you can do that.
And if you offer the discount, if they do the wellness program in order to meet the minimum value, and they opt not to, you can't be deemed for them being above their 9.5%.
So I would say that an employer is not going to offer a wellness program to meet the affordability factor.
Okay.
They're going to offer a wellness program to get the price of the insurance down. So it's not going to make the effect. We're going to look at 3 safe harbors when we talk about affordability. W-2, rate of pay, or federal poverty level. That's the affordability factor. But as far as minimum value of the plan that you offer, you can use wellness programs to count towards that in the calculator. But as
It's
far
not
as the
dollar
price
for-
of insurance is
question
why
is,
wellness programs
is it dollar
are,
for dollar? And I would say no.
It's
So
not.
just be very careful if you say, well, this is how I can get around the minimum or the affordability issue is by putting a wellness plan. I would say no to that. Okay, some other things. If you don't know a good payroll provider, I certainly do in the room, but there are other people out there that have these calculations. You're going to get very close with your payroll vendor if you do payroll in-house. Ask for a raise because you're going to need it. So it's going to be very hard. Because Joanna went through it, and we won't spend too much time on it, but there are going to be products out there based on the calculations. And all of this, I mean, the cleanest data you have is based on what? It's based on that payroll. That's where it all starts. So that's got to be right, and you're going to get the list of the reports that lead to all the calculations that Joanna talked about earlier. So I can't stress to you that how important it is going into next year that you're ready to roll on your accounts. And if you're with a good payroll provider, they will assist you. If you're with a good agent, they'll assist you with that process. The last thing I'm going to talk about is a little bit on the defined contribution plans. How many people in here participate in a 401k? How many people are old enough like me that you were part of a pension once upon a time? All right, so the deal with that is a 401k is, by definition, a defined contribution plan. What we used to have is we had a pension plan, which meant employers went out there and they chose how much they were going to contribute for you based on some sort of calculation. They chose where that money was going to go, and they chose how that money was going to go in. Now it's all changed. Now you have a menu of options available to you, and you decide how much you're going to contribute of your paycheck, and your employer may make a contribution or may not. Some of them may not. So the world of pension plans has changed completely in 20 years. What we see coming is we see the health insurance or the employee benefits marketplace is going to be like this. So what you're going to have is you may have an option out there where the employer says, I'm going to pay $300 a month. But you can go on there and there may be a product out there that you can pick and choose what's best for you. You may want to have a $10 copay instead of a $30 copay. But guess what? Everybody's going to have the same value of their plan. So if you choose that lower copay, then you may have more out-of-pocket exposure than what you have over here. So the employee will be able to pick and choose all what fits them, and they can customize it to what they may need. They may want a richer drug card, and they'll take on a higher deductible or whatever. But the bottom line is the employer is going to say, do whatever you want with this plan. I'm going to contribute this, and you're going to have all these options to choose from.
We see that being the funding methodology towards private exchanges. Really haven't talked about private exchanges much besides the government and public exchanges. Insurance companies are coming out with their own private exchanges, and most of them are based off of a funding methodology around defined contribution. So employee goes shopping with their $300, $400, $500, whatever their contribution is, and they pick a plan that fits them among an option of change.
And to try to simplify the private exchanges, because all of us are going to have some sort of private exchange option, the carriers will as well. Really what an exchange is another way to look at it, it's a platform on which you can go shopping for your insurance. So it's what is available on that platform may or may not make an exchange attractive to an employer to use. Or you have individual exchanges, public and private, where an employee may choose to do that as well. So there are a number of different options that are going to be available for that. The other thing we'll talk about is the old way that we did this, where you saw your agent maybe 2 or 3 times a year, and they came out at renewal, and they showed you 4 carriers. And they maybe showed you a renewal proposal and then an alternate. Well, that is going to change dramatically starting in 2014, because what you may have, let's use Aetna as an example of that. Aetna is just one of the many companies. So what you may get from Aetna is you may get that Aetna normal PPO product with their full network, and here's your renewal option from Aetna. Alongside it, you may get Aetna's exchange option, that you get a different quote or a different product design. Next to that, you may get Aetna's ASO or self-funded option that you're comparing to that renewal. And then next to that, we may show you Aetna's plan using their accountable care organization, which is like a skinny network. So what you're used to seeing and your understanding of what the carriers had to offer is going to change dramatically. So again, get with whoever your trusted advisor is on that, get some good advice, and start early enough that you can walk through those difficult decisions to make a complicated choice a little bit easier. That's the best advice I can give you. Okay, any questions? On your contact information, if you want to contact us, all of us are happy to help you. Mine and Joanna's information is up there. Andrew's information is on there. I don't suggest you try to call the Department of Labor or the Centers for Medicare and Medicaid unless you have all day to be on hold. Or Health and Human Services, they're kind of busy interpreting law for us right now. But they do have some great websites as well, so those are some fantastic resources.
The DOL is where you get the exchange notice.
Okay, any questions?
Excellent. Well, thank you very
Everybody's
much.
hungry, they don't want to have to.
Yeah,
Thank you so much for your time.